I'm Rachel Wilkes. I'm Associate Vice President of Marketing at Meditech. Meditech is an electronic health record company. We serve acute hospitals, physician practices, post-acute care, long-term care, home health. So we provide everything that the health system would need to run their clinical, financial, operational practices. And our customers range from critical access hospitals, community organizations, to large IDNs. So our solutions are scalable to support health systems of any size and shape. So Meditech is a CHIME Foundation member. So we have been coming to ViVE for the past 5 years. ViVE is 5 this year, and we're happy to say we've been here for each of the 5 years. So what keeps us coming back to ViVE is the opportunity to be able to network not only with our customers, but with other health systems and all the innovators that are working in this space. So what we really love about the conference is the ability to hear some really great sessions. Like the content that's been curated for each of these panels has been fascinating. So there's a lot of work and thought that goes into crafting these really compelling conversations. And this year we're really excited about, we had several Meditech speakers on these panels, so getting to talk about our perspectives on how we see the industry, and several of our customers, our health systems, were on panels as well. So it's nice to be able to support them and have their views and be just represented here in this wonderful setting. The most valuable part of being here at ViVE is to just be part of the conversation that's happening. So there's so much that's happening so quickly right now relative to innovation and what's happening at the federal level. So being here and participating in all these conversations and getting to share our views and just really to learn and network with others has been incredibly valuable for us. So we've had several conversations here that have been very valuable in terms of turning into next steps for us. A few have been with health systems. So health systems that are not yet Meditech clients, that we've been able to explain to them our offering and how we're a differentiator, or the different points of differentiation we have from other systems that they may be using. So those have been really productive, and we look forward to taking those to the next level. We've also some great conversations with other businesses that are in this space, and we're exploring opportunities for different collaborations where we can augment the Expanse platform, the Meditech Expanse EHR platform, so ultimately be able to have the best possible solution set to support our customers. We've really enjoyed PPC, and we would recommend that to other sponsors as well. It's a nice opportunity to have just really meaningful, directed conversations with someone that you might not ordinarily meet. So it's been very valuable for us to be able to get to know different health systems, to get some intel about what's happening out in the field, to understand different user needs and pain points that we may be able to have solutions to address. So for us, it's been a really good use of time to be able to have those meaningful conversations. So what's happening after ViVE is we're really excited about all the work that we're doing now, and to take the things that we've learned here, and I think it validates for us some of the development work that we're doing, particularly relative to interoperability in artificial intelligence. So we're excited about the ramp up that we've been doing for our own AI efforts to be able to infuse this intelligence into the Expanse EHR. So we're going to continue down that path, and we have a number of different AI solutions that we're starting to bring to market and engage with our pilot customers on. So which I think we'll have some really nice stories to tell about the impacts that we're making to clinician workflow and to the patient experience as well. The other big thing that we're continuing to work on, and have been working on through 2025 and will continue in 2026, is the expansion of our Traverse Exchange interoperability network to be able to facilitate data exchange between any health system using any EHR that's on TEFCA, and to be able to have some nice new enhancements to that, to be able to see a longitudinal view of the patient's record, all that external data presented in a unified format, deduplicated, and being able to use that to have great insights about your patients and be able to just trend and graph different pieces of information to provide the best possible care for those patients. The most fun experience that we've had at ViVE, I think, is being here and getting to interact with folks. We actually held a happy hour in our booth yesterday at the close of the day, and the opportunity to have people come in, and it was a bit more casual, and folks were just there to really have fun and connect and have a nice drink and a nice appetizer. And for us to have that opportunity to do that as a sponsorship, and to be able to invite folks in and really give them an opportunity to come and talk with us, even if it was someone that we might not ordinarily have met, it was a really good opportunity and obviously a lot of fun. The one word I think about with ViVE is just energy. The energy here is just incredible. Something that I'm looking forward to for ViVE 2027 is being back in Nashville. So Los Angeles is great, the weather is incredible, but Nashville definitely is just as a special place in our hearts. We have HCA, one of our largest customers, who's there, so we spend a lot of time in Nashville and are really excited to get back to Music City.